Let's talk about the stud dog.
Okay, what would you like to talk about?
You know, you talk about all of the stuff that the females need.
Mm-hmm.
Do the boys need anything?
For supplements?
Yeah.
Yeah, absolutely. They should be, of course, on a good quality diet. And stud dogs, after the age of 12, AKC requires a letter from a veterinarian that states that the dog is still fertile. So it's an overage sire letter that we have to send to AKC. So obviously AKC knows that after they get to a certain age that semen quality starts to decline. After age 5 is when it actually starts to diminish. They start to develop thyroid or prostate problems, so semen quality starts to decline at that point because the type of testosterone made in the testicles starts to change. So we start to see benign prostatic hypertrophy, hyperplasia, things along those lines. We'll see testicular tumors. So a lot of things start to change. But a male dog should be on a great quality diet just like our females should, because really reproduction is a luxury of the body. If you're trying to keep your brain and your heart and your lungs and your liver alive, your reproductive organs aren't your top priority. So if we don't have dogs that are on great nutrition and a good nutritional plane, if they're too heavy, too thin, if they've got any health problems, those are all things that are going to cause a decline in their semen quality. So I think that we need to be on an appropriate diet. Rick Kessler at Royal Canin is now starting to recommend the HT42D diet, which is a pregnancy diet for stud dogs as well, which I think is really interesting because it has some anti-inflammatory effects in the diet without it being a drug.
At what point?
I would say probably if he's starting to have a decline in semen quality, or by the time he's 5, I would probably start considering that. But we know that we get much better outcomes for reproduction when we're feeding Royal Canin and Purina diets. I'm universally going to tell you that if you come in and you say to me, I have poor fertility in my male or my female, the first thing I'm going to ask you is whether you're feeding or what diet you're feeding. And I hear people say all the time, I feed a really great diet. I spend a lot of money on it. Well, that doesn't necessarily mean it's the best diet. It might be at the front of the store when you go into the pet store. It might be the first thing that you see on the Chewy website, but it may not necessarily be the best quality food that you could be feeding. So I'm a huge fan of both the Royal Canin and the Purina diets. So Purina Sport 3020 is my preference, and for my stud dogs and my females, either the HT42D for pregnancy or the mother and baby dog products, because those have the nutritional components that we need. And when you look at the label of a bag of dog food, you can look at it and say, well, it looks the same, it's the same. Well, when you look at it, you see the macronutrients, which are protein, carbohydrates, and fats. Those are easy to analyze when you look at a bag of dog food. You can see what percentage those are, like Purina Sport 3020, that's 30% protein, 20% fat. Easy to see. It's the micronutrients that are much more difficult to assess. Those are going to be things like selenium and vitamins and other minerals, manganese and magnesium and phosphorus and calcium and all these micronutrients that are a lot harder to compare one bag of food to the next when you look at the label. So we have seen huge improvements by just switching to a Purina or a Royal Canin diet. I had one client that came in two or 3 weeks ago with miniature dachshunds, and he said, Dr. Greer, I have to tell you something. I'm like, okay. He said, so when I started coming to you, I just moved here to Wisconsin, and I told you that my litter size was pretty small and I thought I could do better. He has 10-pound dogs. And he was getting on average of 3 puppies per litter. And he said, the only thing I changed, both for my males and my females, the only thing I changed was dog food. I didn't change any supplements. I didn't change my heartworm and flea and tick meds. I didn't change anything in my environment. I went from what he was feeding, which I will not mention the name of, to Purina Sport 3020, and he went from 3 puppies a litter to 7 puppies a litter, with that as being his only change. And it was the same 3 bitches. So it wasn't as if he switched up the fertility or the dogs in the program. So those girls were all at least a year older and had improved fertility. How much of it was the stud dog, how much of it was the bitch, is hard to analyze, but for sure, there's no question that there's a definite correlation in nutrition. So once we get past just good basic nutrition, I like the ICSB CF Plus. I think that's a good one. That's a Perna muscle base. They have an advanced formula. I like Be Strong, which is a Revival product. We have at Revival a number of other fertility products. We have In Between for him. We have Oxystud. You know, there's a lot of products on the market, and you can find a lot of products, but it's hard to tell what's in nutritional supplements. Then when we start looking at the semen under the microscope, if we see bent or curled tails, that can sometimes be reflective of some other nutritional issues. So we'll add L-carnitine to the as a supplement, and you can buy that over the counter. It's not a prescription item, and we'll start to see some of those sperm abnormalities straighten out. So, you know, it may be thermal, it may be nutrition, it may be disinfectants in your kennel, but there's definitely some nutritional components to what goes on with male dog fertility.
What does Oxystud do?
It has some anti-inflammatory effects, basically, that just improve semen quality. So we have to have good, when we look at semen, we look at 4 parameters. We look at morphology, which is the shape of the sperm. We look at motility, which is how it swims. We look at sperm count, so the number of sperm, and then we look at longevity. How long does the semen live once it's put in an extender and we stick it in the fridge and come back 2 and 3 and 4 days later and look at it to see how long it stays alive when you warm it back up. The other parameter that's a little bit harder to measure is the DNA component to it, which is we do with the nucleo counter, and that assesses the semen viability and in another format. So those are the parameters that we look at.
I just had mine collected.
What's
I just collected
Oh, okay.
Henry,
Okay, good.
and he had good numbers, they
Good.
said.
Good. So sperm counts should be roughly 10 million
So
per pound
if
of
they
body
want to
weight.
see this,
So he should have 10 million sperm per pound of body weight. So according to this, he should be a 48-pound dog.
okay,
He's what, about 20 pounds?
yeah.
So he's got roughly twice the number of sperm
was
that
that?
you would expect.
We just did our dog here. He's like on the line of that. What was Lenny?
He's around 6 million.
He weighs 14 pounds.
Yeah. So we would expect to see about 140 million. So maybe it was a little bit more than that.
Yeah, it was like way high.
Mhm. So then we look at viability, which is what the nucleo counter can tell us is how much, not just are they swimming, but if they get into the reproductive
Oh, yeah.
tract, are they effectively going to fertilize an egg? So viability is really an important parameter. So those are the things that we can really measure. And according to this, he's got 95% motility and 88% viability. He's got, you know, great semen, and he's 6. So that's the age at which you can start to see a decline because of the prostate.
And they
and-
did check that in the spine.
And with prostate disease, we'll see it flare up when females are in heat and the dog is around them. Sometimes even just going to a dog show or sharing a hotel room for a weekend with a dog in heat can throw the male's sweet semen quality off because their BPH will flare up and you'll have blood in the ejaculate.
Oh, wow. Okay.
So, yeah, so we see a lot of fertility things that are related to age, related to environment, related to nutrition. So there's not a magic drug that we can put most dogs on. Finasteride does a great job for dogs with BPH, but if you have other issues, we don't have some magic pill that we can just reach for. And it's usually not a bacterial disease. Most people want to just put them on an antibiotic because they know what an antibiotic is and they feel like it's safe. But it's not always safe to just willy-nilly put your dog on antibiotics. So we don't recommend that routinely. And if we do see blood in the ejaculate or blood dripping from the penis in a dog that's over age 5, or a Bernese Mountain Dog that's over age 3, we're going to be looking at BPH as a possible cause. And antibiotics don't fix BPH. A lot of veterinarians will use them because they see blood, they don't know what else to do, so they put them on an antibiotic. But BPH is not going to respond to antibiotics because it's a hormonal disease, not a bacterial disease. So it's important if you do see that blood dripping from the penis or in the ejaculate that you address it with somebody that is versed in canine reproduction and isn't going to just hand you a bottle of pills that's an antibiotic and think that that's going to fix your problem. Does that answer your boy dog question?
Yes.
Yeah. There's a lot of male fertility supplements on the market. It's hard to tell how well they work because it's really difficult to assess. Nobody's really done a study on a large population of dogs and their fertility and nutritional supplements, and we really need that. So we need to find some nice young veterinary student that wants to go into canine reproduction and do some research on it. And NKC actually funds, with the Theriot Foundation, they actually fund internships and residencies at some of the veterinary schools. So we have some hope.
So, I have a little guy that has like some issues, like when the females go in heat and stuff. So should I just like collect him when the other females go in heat, and then?
It makes it a lot easier if you are going to collect and freeze when the girl's in heat, because then you bring the girl in and use her as a teaser.
But I mean, I wasn't going to breed him, but he just goes bananas.
I would for practice.
Yeah.
And then
Speaking
would
from
that,
personal experience, my male was like.
for lack of a better term, like relieve some pressure, so to speak, on him? Would it be better on his?
Some dogs are better, some dogs are actually worse, because then they figure out that they, yeah, so it depends. If you're never planning to breed him, then you may want to just neuter him.
No, we
You
still
plan to
want to
breed him
breed him,
later.
but he gets
Oh, yeah.
he gets.
Then they're right. Get him used to being handled and
I
collected.
would collect them then.
Because some dogs don't willingly allow us to collect them, and so if he gets familiar with that, it actually helps them quite a bit to
He knows how to. He's been collected.
But it's his. I think it's his prostrate. Like when the females get in heat.
How old is he?
He's a little bit older.
3 or
I was
4
thinking he should
maybe?
probably come in for an exam.
Yeah,
We've
yeah.
just been.
It'd be a good idea to have him evaluated. We can check the prostate with a rectal exam. We can do it with ultrasound. It's a good idea to see what the semen quality looks like, because we do see BPH cause a decline in semen quality. So putting them on finasteride can really be helpful in keeping them fertile as they age. Because you don't want him to lose his fertility. We want him still.
Yeah, I'd
able to
actually
breed.
like to lose him, but the last couple of times that we've bred him, use him, not lose him. The word is
That was Freudian.
But he hasn't gotten him pregnant, so I just bypass him and use somebody else. And then I was like, I should probably not do that.
Then we need to figure out why he's
Yeah.
not getting him pregnant.
Because we have from one extreme to the other. We actually had a dog that's going on 13, and he just produced a litter of 7 puppies.
Yeah.
Not even knowing that he needed to be checked, but
Yeah.
obviously he's doing it.
Yeah.
And then we have that other guy that he's frozen here, and we just so I'm not obviously remembering the numbers because they're always kind of impressed is the word,
Mhm.
of, how much he weighs and
What
the
his semen looks like.
volume, and then it's always the mobility and all those things are very
Right.
good. But then we have this guy that we've just been kind of bypassing so we should really probably get
Yeah.
him checked.
Yeah,
Because then maybe he just needs to be neutered then, or
yeah, either we can make him better or not, and if he's
Right.
not something we can correct,
someone might
then
frustrate him because he
Exactly.
is pretty.
exactly. Unless there's some reason to keep him intact for show reasons or
No, we're not showing that.
something else. So yeah. So neutering him might be the best solution. And
We're
again,
saving some of that sperm.
and
He's
again,
our most
people wanna
expensive
use,
dog.
Of course he is.
Oh, totally. We
But-
tested so many litters with a breeder for like 6 months, and then he got hit by a something and $5,000 later on his leg, and
6,700, but who's counting?
Yeah. Nobody.
and his temperament's not so great, but
He has a great
babies-
temperament.
His babies are the best babies in the whole wide world. But whatever. Anyway, he barks. Doesn't matter.
He
He's got
barks
the
a
idea.
little.
Yeah. Yeah. So it's worth checking out to see if there's something you can do to improve his semen quality, and if not,
Yeah,
cut your losses.
absolutely.